Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. Flu outbreaks are occurring all across the country 3 months earlier than usual because of the circulating H1N1 virus, also known as the swine flu. Hospitals are dealing with a particularly high volume of H1N1 cases, including right here in Northwest Arkansas. The virus is already sweeping across the University of Arkansas campus, but fortunately, the majority of cases have been mild. Tonight, we are joined by Dr. Stephen Hannigan, an infectious disease specialist, to talk about this year's unique flu season and to learn ways for you to stay healthy during this time of the year. Dr. Hannigan, welcome to the show.
Thank you very much.
Thanks for being here with us. We appreciate it. Why is it so complicated this year? What's going on with all the different viruses, the flu viruses?
Well, of course, we all heard the story about the bird flu or avian influenza, and we were all anxious that we might have this new pandemic with a flu strain that we'd never seen before. And the common talk among people in my specialty was it's not, if, it's when this is going to happen. And, frankly, that's kind of what happened. The fortunate thing about it is the avian influenza, which wiped out, a good chunk of our population in the 1918s period of time, was not the pandemic strain. It turned out to be this new virus that nobody had seen before immunologically called the swine flu. And there were parts of this that came from swine, and parts came from avian or ducks, and parts of them came from humans. But we saw this, of course, in Mexico is where the big kind of scare came out. But nobody really knew how severe this was going to be in terms of how sick it made people. But indeed, this is a new virus that's come all across the world, and this is what happens every so often. And the very fortunate thing is that this particular virus is proven to be not so angry and virulent as some of the viruses in the past. So what we're seeing is lots of people are getting infected. Not many people are dying, but there are some people that are dying, and that's why the CDC and all the authorities are being really careful to take action and encourage the population to be wise in how they do things. So
how do you prevent the spread of the flu, Dr. Hannigan?
Well, there are some real simple things that can be done. First of all, when people transmit the flu, it's basically a matter of you've got to be in contact with people. And so one of the things that's been really encouraged is that people who have influenza-like illnesses don't go to work, don't go to school until they've been without fever for 24 hours. If you do have to go out and you're sick, then if possible, CDC recommends that you wear a face mask. If you don't have one, then bring some tissue, and if you sneeze or cough, put it over your face. This is a droplet spread virus, and what they say is it's about 3 to 5 feet is the length that you can cough it. And so it's really not a situation like we have to be panicked and afraid, but yet they're just some kind of common sense things. So you just don't go to work. You don't let your child go to daycare if he or she is sick. And if you go to the doctor for something, you should wear a mask. And if you can't, separate yourself off and cover your face. As a person in the population who's not ill, there's some things that can be done, and I think that probably the most effective thing is going to be to be immunized. Now, the pandemic flu strain, as they're calling it, or the H1N1, the vaccine is not ready yet. It's not going to be out for probably 2 or 3 weeks, and but at times it's difficult to distinguish seasonal flu from H1N1. The symptoms are pretty much the same, and so the wise thing to do is when you have an opportunity to get immunized.
I see. So you've mentioned earlier fever, cough. What are some other signs and symptoms, Dr. Hannigan, of the flu?
Well, it's important to know that not everybody has fever, but basically the kind of hallmark symptoms of the flu, and this is any influenza illness, but fever, muscle aching, cough, sore throat, sometimes a runny nose. Typically, what I was taught in training was that there was a common feature where our eyes got real bloodshot. I've not seen that so frequently these days, but and you know, it's stress that most people who get the flu have a pretty mild illness, and it's not necessary even to go to the emergency room or to the doctor unless you're sick. And there's signs of, you know, what does that mean? What does it mean if you're sick? But people who are lethargic, who are delirious, people who are short of breath, and children who just sleep and they're not arousable, those are people where they need to seek medical attention. People who have underlying immune system problems, if they get sick and they're not very sick, they should call their doctor. And what I mean by that, by underlying immune system problems, actually it could be something like asthma or lung disease. It could be lupus or something requiring medicines to suppress the immune system, or cancer, those sort of things. And so those folks should call their doctor. If a child, we say under age 5, we get more anxious about, and especially under age 2. The one thing about the pandemic influenza is that though the death rate is not terribly high, what we're seeing is that the population that it's affecting is different. And the thinking is that elderly folks over 65, have some immunity to it. So what we're finding is the folks who tend to die from it are between ages 20 and 50. And that's another good reason. I hear people, those of us who are old enough to remember the Carter administration swine flu, there was quite a lot of hysteria, and it's one of those things that was criticized widely. And I hear people say that that when the swine flu shot's available, they're sure not going to get it. Well, I'll promise you I'll get it, because, you know, even though most people do all right, if you're the one who happens to get way sick, you know, then that's a bad deal.
Would you say the difference between, for example, the swine flu, the avian flu, and the different types of flus are the origin and the severity of symptoms?
I think that the difference tends to be in the influenza. When people die from it, they die for 2 reasons. One is they get influenzal pneumonia, and they get this terrible bleeding into their lungs and inflammation. And there's certain proteins that make the influenza virus more effective at that. The other reason that folks don't survive is because they get secondary bacterial pneumonia.
I see.
And I think that in general, the difference between these viruses has to do with their ability to cause damage to the lung tissue.
How can we treat the influenza, Dr. Hannigan? I know there's Tamiflu out there, and ranitidine, and supportive care, but is that pretty much it?
Yeah, and it's interesting. When you read the CDC website, they suggest that
not to use it.
Not to use it. And the reason is we've all seen how and heard about drug resistance. You overuse antibiotics and drug resistance occurs. And so there's a strong emphasis, well, if you're not really that sick, you probably don't need to take Tamiflu.
Well, what about in those who are at high risk, like, for example, healthcare workers and hospitalized patients and pregnant women?
They should definitely take Tamiflu. Okay. And I'm glad you brought up the pregnant women thing, because that's really important. And those fall into that category of people who need to be careful.
How many cases have you seen here in Arkansas? Do you know?
I have seen probably 5. I think they're more than that, though. And my specialty, I see the bad stuff, and often, you know, the sort of frontline people, and particularly the emergency room, see it. But I've heard, you know, there are lots and lots and lots of positive flu swabs through the emergency room. So
I diagnosed maybe 4 or 5 right before I came here today. Any last-minute words or advice, Dr. Hannigan, on how we can protect ourselves from the flu, keep ourselves healthy? I think good hygiene and common sense. Sounds good. Well, thank you so much for being here with us and educating us. We appreciate it. Thank you. Stay with us. Family Health Today will return in a moment.